following Men's Health Month Spotlight is sponsored by Fairfax Radiology Centers.
It's June, it's Men's Health Awareness Month, and we're here with Fairfax Radiology Centers and talking to Dr. Cullen Ruff because we need to discuss something that's important to men that sometimes people don't want to discuss, and that's prostate disease. Let's talk about it. First of all, what are some symptoms? Maybe you don't even know you're experiencing them.
So the prostate is a gland that sits below the bladder in men, and as we age, oftentimes it can enlarge. When that happens, it makes it more difficult to empty the bladder completely. That means men may feel that there's a weak stream, weak flow. They're going to the bathroom more frequently, and that can mean getting up more at night, which is disruptive to sleep as well.
So obviously, I think you'd notice if there was an issue happening out there. So the next question is maybe things you can do to prevent prostate cancer. Are there options?
There are. Now, those were the symptoms of enlarged prostate, which doesn't necessarily mean cancer. Prostate cancer may not have any symptoms at all, and that's why it's important to screen for it. The prevention is still something that's under study with research, but we do know that in general, a healthy lifestyle, which includes good sleep, good exercise, and a healthy diet rich in fruits and vegetables. We've all heard this, particularly for prostate cancer. Supposedly cooked tomatoes have a nutrient called lycopene that's preventive. So I can't recommend the burgers or hot dogs, but the ketchup, you got clearance on that one.
Put that down. So let's talk about some of the recommendations for prostate cancer screening. There's different options there?
There are. So most experts agree that between the ages of 55 to 70 for general population, if you don't have an increased family history risk, that's a good age, 55 to 70, to be getting an annual blood test. It's called the PSA, prostate specific antigen. It's not perfect, but it will often detect prostate cancer. It can also go high for benign reasons like enlargement, inflammation. So men don't need to panic if it goes high, but that's the blood test. And it should be gotten earlier if men have a family history of a brother, a father who's had prostate cancer. And for your viewers, men who have African ancestry have an increased risk of getting prostate cancer. And so most recommendations are for men with African ancestry to start in their 40s getting the PSA blood test.
So in addition to the PSA blood test, sometimes you need to do imaging. What are some of the ways to go about that?
Well, the imaging is very important these days. So if the PSA is high or there may be other reasons to image, MRI, which I've got a couple pictures on our screen, that's the best test to look for prostate disease. It will look for enlargement, but it's also the best study to look for cancer before a biopsy is done. And so a biopsy is needle placement to get tissue and see if there's tumor, and the MRI is the best way to find what needs to be biopsied. And it may say that there's nothing suspicious that really needs a biopsy right now, and that you can just follow the blood test and check later.
All right, what about treatment then? What are our treatment options for prostate disease?
They vary. So it depends a lot on, is it a little bit of cancer? Is it a lot? Is it a low-grade cancer? Is it more aggressive? A small amount of a low-grade cancer may not need treatment at all. You have to take into consideration the patient's age, other health factors, other health issues they have. And so usually it's going to be a combination of a urologist, who is the surgeon who specializes in the urinary tract, plus an oncologist, including radiation oncologists who treat cancer with radiation.
And any special requirements for people that have low testosterone?
I'm glad you asked that. So men who are taking testosterone supplements should be doing so under the care of a doctor. Those don't necessarily cause prostate cancer, but if you happen to have one already, testosterone can make prostate cancer grow. So I do recommend that if people are interested in testosterone supplementation, do that with a doctor's supervision.
All right, Doc, thank you so much for your time. More information on your screen. You can learn more about it and get out there and take care of your health, fellow guys.